Hi, everyone. We'll just give everyone a couple of minutes to jump in and then we'll get started. Hello, nice to see your faces. Give everyone a couple more minutes. There's quite a few people still coming through, so I'll give it another minute or so. Okay, I might get started. Veronica, is that okay with you? Great.
Yeah, oh good.
Thank you. And we'll just let people come in as they do. Hi, everyone. My name is Deepa Jayapalan, and I'm the manager of the Healthy and Sustainable Food Systems team here at Vic Health. I'd first like to start by acknowledging our First Nations people, the traditional custodians of the unceded land, skies, and waterways in which you are all dialing in from. So here at the Vic Health office, we're on the land of the Wurundjeri people of the Kulin Nation, and I'd like to pay my respects to elders past, present, and emerging, and acknowledge that sovereignty was never ceded. Well, this is our first time. Also, sorry, I'm just going to add, if you would also like to add in the name of the traditional land that you're on in the chat, that would also be great, and pay your respects in that way. So I would just like to first thank you all for coming. So this is the first time that Vic Health has hosted the Healthy Supermarkets Community Practice, and we feel really lucky to be able to do that. So please be patient with us, and if you have any feedback about how we're doing, we're very happy to hear it. But yeah, just thank you so much for coming along and welcoming us into your community of practice that you have all been a part of. Just a few housekeeping matters to please stay on mute unless you're presenting or speaking, just so you can always hear the person that's speaking. Please also give yourself an identifiable participant name, so perhaps your name and also the organisation you're from, so that people want to connect with you afterwards. It's easy for them to do that, or they know the context that you're speaking from as well. We encourage you to ask questions, so please use all the chat for all questions and comments, and the chat will be moderated by our team here. There will be an opportunity in the Q&A session to raise your hand and unmute yourself then, and to ask a question. Have your camera on if you're comfortable. The session will be recorded and slides will be emailed out and publicly available on the Nourish Network website afterwards. So great to see some comments and chat on the chat coming through with people acknowledging their traditional country that they're on. So that's excellent. Thank you, everyone. And just a bit of a agenda of what we're doing today. So we'll give a bit of an overview of the Healthy Supermarket Community of Practice. Some of you might be really comfortable and know a lot about this work, and some of you may be a bit newer to it. So we'll just make sure that everyone's at the same page by giving you a bit of an update. We have Victoria from Nourish Network, who will be giving us an update on Nourish Network's work to date. You may have seen a supermarket needs assessment survey that went out. I think it feels like it was a while ago, a few months ago, where we asked you what you wanted from this Healthy Supermarket Communities of Practice. Veronica, who led that, will be presenting that from our end. And then we'll have a few guest speakers who I'll talk through in a second, and some other community health updates and a Q&A session. We'll also have a break, and we'll also have a breakout room so you guys get to talk to each other, learn about each other, and share your learnings with each other. And then we'll wrap up after that. So it is 2 hours, so it's a pretty long time to be sitting down. So hence we've got a break, but also feel free to move around, and hopefully we'll keep it as interactive as possible so you don't get too tired listening to a long Zoom call. So just introducing our presenters today. We feel very lucky to have some amazing presenters today. I won't go into the details of their bios quite yet, as you'll hear more about that later. So we have joining with us Dr. Christina Zorbas from Deakin University, who's a research fellow with us at Vic Health, and I feel very lucky to work with her quite closely. We've got Freddie Thuruthikatu from a Health Promotion Officer from Ballarat Community Health, Irene Dunn-Pfeiffer from a Health Promotion Officer from Eastern Health, and Benjamin Bruin, a Senior Health Promotion Officer also from Deakin Health. So we're really excited to have all these presenters here today to hear from, to learn from, and I'm sure you'll really enjoy their presentations as well. So just a bit of a background on the Healthy Supermarket Community of Practice. This Healthy Supermarket Community of Practice aims to support a group of health promotion workforce across Australia who work with supermarkets to come together and share best practice learnings and ideas about creating a healthier supermarket shopping environment. So how can we work with supermarkets to offer more nutritious, culturally appropriate and local environmental sustainable food? This work was established by the team at Healthy Greater Bendigo, and we really commend their leadership in this work, and we feel very grateful to be able to take that on. And we are working with the Nourish Network through this community of practice as well. So the community of practice is based on high levels of interest that came about after the Eat Well at IGA project in Bendigo, growing number of practitioners, and complements the research focus of the Refresh Centre of Research Excellence as well. The community of practice includes members from local and state government and community health and research institutions from Australia and New Zealand. So we feel really lucky to bring everyone together, and can see that there's just more people that keep entering the waiting room and coming through. So it's great to see the interest in this community of practice as well. For those of you who may not know who Vic Health is, just give a quick update about who we are. I'll give you a bit of a brief understanding of the work that we're doing if you're not so familiar with what we do. So some of you are quite familiar, I see a lot of familiar faces on this call. So Vic Health, we are the Victorian Health Promotion Foundation, and we exist to create a healthier Victoria, one where everyone can live a happy, healthy life where they thrive. Promoting good health drives everything we do. It's behind the world-class interventions we create, the important research we lead, the public campaigns we deliver, and the experts' insights that we share. We're leading change and are determined to make a real and lasting impact on the health and well-being of the people of Victoria. So Vic Health works across a 10-year action agenda, and we are in the last 3 years of our action agenda. We reflected on the difficult couple of years that Victorians have faced, so much upheaval in day-to-day life, and looked at what we needed to do to continue being meaningful and impactful in our work and support Victorians when they needed us the most. So we also, in this process, we heard about the experiences of young people, particularly children, young people, and the disruption that the pandemic caused in their lives on their ability to be healthy and well. And so that's why late last year, some of you may have seen that we launched a new strategy called Future Healthy. So Future Healthy represents a state that we all want to live in. So one where we can live, work, and play in a healthy way, and it doesn't matter where you're from, your bank balance or your background, that you all every young person gets to live a happy and healthy life. So we see a future with vibrant communities where young people are connected, active, enjoy fresh food, and feel great. A future inspired, shaped by, and shared by the people of Victoria. Future Healthy is an investment of $45 million over 3 years, and you may have seen announcements of initiatives in Future Healthy, including Big Connect, Jumpstart, and the Activating Underutilised Spaces investment to support more young people be active in their local area. Our team, so you may see a few familiar faces. We've got Veronica who's on the call, Julian and Nicola are also behind the scenes as well, and we've got a couple of other team members. So we make up the Healthy and Sustainable Food Systems team and we sit within the Future Healthy group. There is also the social connection and mental wellbeing domain and the active community support domain as well. So for us, we are thinking about how can we remove the barriers that prevent children and young people from accessing and enjoying nutritious, culturally appropriate and locally sourced food. Recently, we launched a few new investments that I'd like to briefly share with you, and if you'd like any further information about them, please reach out to us. So at the start of this month, we launched what we call our Move the Dial investment. So this is a large-scale investment that we hope to really shift the current landscape on an issue that we feel very passionate about, and that's about access to nutritious and culturally appropriate food. So this is an investment of just under $4 million over 3 years. That will increase accessibility for Victorians living in regional areas and growth corridors of Melbourne to access nutritious, culturally appropriate and environmentally sustainable food. So we know, and I'm sure you all know, that it is currently a privilege to be able to do these things, and we want to dismantle that completely. And we believe that everyone has the right to do that. So we're looking for up to 10 community-led grassroots organisations to partner with in setting up or scaling up spaces that we're calling food hubs, where healthy food can be sold, but also where communities can come together to share cultural practices around food and learn about the food systems. These spaces will also employ young people who will undergo a food systems traineeship program where they'll build their capacity in community mobilisation, advocacy, and learn about the food system in all its complex and nuanced ways. Like you all, we all want more young people to be advocates for a healthier food system, and we hope this program is a pathway for that. Another exciting announcement that we made, this one was brand new, was yesterday. We announced our brand new partnership with Launch Vic. So Launch Vic are the Victorian government agency for tech startups. So we'll be working with Launch Vic to run a 6-week pre-accelerator program for tech startups to solve 2 key issues around food systems. The first one is around supporting young people to access healthy food in their communities. And the second one is to uncover and expose unhealthy food advertising targeted at children and young people. We're incredibly excited about this partnership, as I'm sure you all know as well, that we need to be working outside of our silos in solving crucial and complex problems like this. For those of you who work in local government, you might be more familiar with this piece of work. So the Victorian Local Government Partnership, VLGP. So we're partnering with Victorian local governments to improve children and young people's health and wellbeing through municipal public health and wellbeing plans. The way it works, we worked with experts in key areas to create modules, which is a consolidation of best practice, evidence-informed policy, program and practice change that local government can implement to improve the health and wellbeing of children and young people in their community. Funding and capacity building, community practice and evaluations all form this massive package. And it supports the delivery of the 10-year action agenda and aligns to the public health and wellbeing plans as well. So we're currently we've moved along to kind of the second phase of the program. So the starting part of it was creating 2 foundation modules called Connecting the Dots and Leading the Way about how to work with young people. And then now we're in a phase where we've working on and delivering the other core modules, which are around building active communities, creating connected and supportive communities, and building better food systems. There's also a couple of stretch modules around promoting healthier everyday creativity at a local level and strengthening tobacco control at a local level, increasing alcohol harm prevention at a local level as well. So we've had original fast track councils, which are 16. We've got modified fast track councils that are coming in. So we're able to build that work and work with more local councils, which is excellent. Another part of our work that you may not see as publicly, and that's quite intentional as well, is our commercial determinants of health work that we do. So the commercial determinants of health team focuses primarily on the impact of product and practices of harmful industries such as alcohol, tobacco, unhealthy food, and gambling on health and well-being. These products contribute to around 2/3 of chronic disease burden in Australia, but as the term infers, commercial determinants of health also requires us to think about commercial actors and how they can contribute better and constructively to maintaining and improving health. So this is a perfect place to be talking about the commercial determinants of health, as supermarkets are a good example of a commercial environment which can contribute to health as well as harm through products, the way they're sold, and how they're marketed. So commercial determinants can be thought of a bit like social determinants. So I'm sure so many of you from the health promotion world are very familiar with that term. So they are the factors in which individuals may have limited control over themselves as the system they exist in shapes their world and options available to them. We work with partners and researchers to understand, increase awareness of, and mitigate the impact of these industries and their products on health. So some of the activities that we do include exploring the contribution of marketing, particularly digital marketing and sports sponsorship, to health and harm, and measures which might reduce them. Partnering in development of digital literacy modules for teenagers to critically appraise harmful marketing. Supporting community and local government activities and interventions to prevent harm from alcohol and tobacco use, and implement a harmful industries relationships policy which assists with preventing conflict of interest for Vic Health grants, procurement and partnerships, and encourages aligned sectors, including sports, to pursue healthy, not harmful partnerships. So if any of you have applied for our grants before, I'm sure you're familiar with the harmful industries policy and the declarations that we ask for in the people that we partner with as well. So I feel like I've done a lot of talking, so I'm very happy that I get to have a bit of a break and also introduce Victoria from Nourish Network. So Victoria is a coordinator of the Nourish Network, a multi-sector collective working to increase demand, availability and access to healthy, sustainable, affordable food. Nourish Network is part of Deakin University's Institute for Health Transformation. The primary focus of Victoria's work is to transform food retail for the better health of people and the planet. So welcome, Victoria, and thank you for being with us.
Hi, Deepa. Thank you so much for the welcome and the introduction. Hi, everyone. As mentioned by Deepa, the Healthy Supermarkets Community of Practice was started by Healthy Greater Bendigo and Nourish Network. We're very excited to work with Healthy Supermarkets, as there was a really clear alignment between the COP's aims of sharing learnings to create healthy supermarket food environments and Nourish Network's strengths in translating research to policy to be health enabling. The addition of the Healthy Supermarkets Community of Practice has expanded the impact of Nourish to the supermarket setting, where the majority of food is purchased in Australia. As mentioned by Deepa, we're really happy that Vic Health were keen to lead the COP, combining our shared vision of improving the healthiness and environmental sustainability of food retail environments. It's great to see positive change being made in this space in Victoria and also across Australia. You may have seen some images shared on social media of the IGA supermarket in the Bay of Fires in Tasmania, who are inspired to make healthy changes to their displays based on learnings from a healthy retail course run by Monash and the Refresh CRE, which you'll hear a little bit more about later. If you'd like to learn more about the work of Nourish, our action teams, or our community of practice capability, please visit our website, nourishnetwork.org. Thanks, Deepa.
Great. Thank you, Victoria. So great to have you here. We really appreciate all your support that you've given us in setting this up and learning, getting our feet and, trying to figure out how to run this community of practice. It's been so great to have you on board and supporting us along the way. So next up, I'm going to introduce Veronica Nunez, who is the lead in the Healthy and Sustainable Food Systems team. Veronica has been leading a lot of this work, and she'll be presenting the results from the needs assessment survey that many of you would have completed. Over to you, Veronica.
Thanks, Deepa. As Deepa mentioned, I'm Veronica. Lovely to see so many faces today. A lot of familiar faces and a lot of new faces, but great to have you all on board on our first journey of the Healthy Supermarkets Community of Practice. As Deepa mentioned, I'm one of the leads in the Healthy and Sustainable Food Systems team at Vic Health. And as many of you may be aware, we did send out a needs assessment survey to all members back in March, and I'm here to share the results with you today. So a big thanks to everyone that did fill out this survey. We had about a quarter of our community of practice members respond. So these results are based on a smaller sample size of our entire community of practice. So I'm happy to share these with you now. So not surprisingly, 70% of members that responded were from regional Victoria. Most of our members are from regional Victoria. 26% were from Metro Melbourne, and 4% that responded were from New South Wales. Most respondents, around 71%, were from a health promotion background. Again, no surprise. And this covers public health, nutritionists, and dietitians. 15% of respondents were in research, so doing research in this space. We had 7% from local or state government, and another 7% in other roles such as a teaching capacity or other businesses. So since the inception of the community of practice back in 2019, majority of members responded that they had attended at least one or two events, so 85% of you. We had 8% had attended 3 events, and a smaller percentage, 7%, had been with us all the way from the very beginning and had attended all. So it's great to see. So we asked you, moving forward, I guess, how often would you like this community of practice to meet? And we had 63% of you respond in favour of quarterly community practice sessions, which is double the amount previously, which was twice a year. So we have taken this feedback on board, and we're really pleased to share that we'll be running these community of practices on a quarterly basis starting from April this year. There was a pretty even spread in terms of community of practice event duration that you'd like to see. So I guess 52% said 2 hours was fine, and 48% said 1.5 hours. So taking this feedback on board, we will continue with this 2-hour time frame, but we do know that you will appreciate having time back in your day if the event happens to finish earlier as well, because we do understand it is a long session to sit online for. Not surprisingly, we have a very passionate and dedicated bunch in our community of practice who are already doing work supporting their local communities in healthier supermarkets. So 40% said, yes, we are already doing the work. 33% are really interested to get involved in this space, so they're just keeping abreast. And 27% who are not yet, but they're obviously interested, staying involved. So when we asked members to rank a list of potential topics moving forward that you'd like to see presented on, the following listed as the most popular. So policy approaches, access to local and environmentally sustainable food, involving children and young people in the advocacy and leading this work, having an equity focus, looking at supermarkets and food relief, tips for successfully engaging with supermarkets is an ongoing topic of interest, suggestions on co-design with communities, so how to do that, and access to culturally appropriate food. Some other topics that you were interested in learning more about included scaling up initiatives that have been trialled in your local communities, end of aisle changes, so learning more about that, climate change, circular economy in supermarkets, and engaging with investors such as loyalty reward programs. And when we asked if there were any other organisations that you thought were currently not involved in the community of practice that could provide a beneficial perspective, you responded with supermarket reps, so having them on board in this community of practice, community advocates, councils, health insurers, neighbourhood houses, and other marketing and advertising professionals to get their perspective. So just over half of respondents, around 52%, were in favour of the community of practice to expand its scope and explore other harmful products and practices relating to supermarkets, such as alcohol and tobacco. However, there was some hesitancy with some members feeling that it is a different issue. They feel they're new to this area, or they're currently not prioritising this in their work. So mixed result there, but mainly in favour to kind of looking at, as Deepa mentioned, those commercial determinants of health and working in a systems way, and really looking at, you know, how it's all interrelated, that it's much more than food as well. And lastly, we asked you whether you'd like any other opportunities to connect in between sessions, and the majority of you, 94%, welcome the possibility of having other opportunities to connect. So we're really excited to launch, before we wrap up today's meeting, what we've planned for you to keep in touch and to be able to share those relevant links, resources and events, so you are staying informed in your work. So that's all from me. Thank you very much, and feel free to pop any questions in the chat. I'm happy to answer these as we go or later on in the Q&A session. But yeah, we really appreciate your feedback. This community of practice is for you guys, and we wouldn't run it without you. So your feedback is highly valuable. So next up, I'm really excited and happy to introduce Christina Zorbas to you, Dr. Christina Zorbas. She is from Deakin University, and she's our guest presenter today. So studying a PhD allowed Christina to reimagine her career in public health nutrition and led her to become a postdoctorate research fellow at Globe. Her work has always had a strong equity focus and explored policies to reduce inequalities in population diets through equitable food pricing policies. Christina is currently undertaking a 3-year Vic Health Research Fellow to support efforts to improve the wellbeing of Victorians facing disadvantage and inequity. This will include working in partnership with community members and organisations to find the best ways to include the voices and the values of people who experience socioeconomic disadvantage in food policy processes. She was recently awarded the Premier's Award for the Health and Medical Research in 2001, and Christina hopes to become one of the next generation's international research leaders and share her knowledge locally and globally. Welcome, Christina. Very excited to have you on board today. And Christina will be talking about the cost of a healthy supermarket shop and policy opportunities to enable people with lower incomes to access healthy diets. Take it away, Christina.
Thanks, Veronica. And just checking, you can all see the slides?
Yeah.
Cool. So hello, everyone. I am honoured to be here presenting to you all today. Like Veronica said, the topic of this presentation will really focus on 2 main questions that we've been trying to address over the last 5 years. And that's firstly, what's the cost of a healthy diet and how does that differ to the cost of unhealthy diets? But secondly, what do we actually do about it in terms of improving the economic accessibility of healthy diets for everyone? I'd also like to start by acknowledging the traditional custodians of this country and pay my respects to all Aboriginal and Torres Strait Islander peoples. I am also on the lands of the Wurundjeri people today. And just to give an overview of the topics we'll cover, I guess we'll talk about food price and hopefully try to convince you all about why it's one of the biggest determinants of diets and what we choose to eat and inequalities in diets. how we go about measuring food price in Australia, challenges and opportunities associated with this, and future directions. So what else do we need to be doing in this space? And again, I don't think I need to convince you all, but basically we know that unhealthy diets and dietary risks are leading contributors to premature death and disability globally. But what we also know is that so is a low socioeconomic position. And this study a few years ago actually showed that a low socioeconomic position is one of the strongest predictors of premature morbidity and mortality, and that the effect of a low socioeconomic position on health is actually comparable to things like dietary risks, tobacco smoking, and physical inactivity. We just haven't really combined the two risks together to date. And so that's what most of our research focuses on. And so this is a study that my supervisor, Associate Professor Catherine Backola, conducted a few years ago. And it basically shows what happens when you do bring the risk factors together. And so on the y-axis, we have diet quality scores. And then on the x-axis, we have 3 different indicators of social position. And what the data really shows is that irrespective of the indicator, whether it's education, income, or area level deprivation, we can see that people with lower social statuses tend to have the worst diet quality scores. And so really, there are many reasons why we need to be reducing inequalities in diet-related health, but for me, no one sums it up better than Nelson Mandela, and that's because health really shouldn't be a matter of income or any other social indicator. It should be a fundamental human right. And so at Globe, the Global Obesity Centre at Deakin University, the team that I work alongside, we're a World Health Organization collaborating centre for obesity prevention. You've probably heard of us through the supermarket work that Globe led, including the Eat Well at IGA intervention, but I actually sit in the equity in food policy stream. So whilst all the streams cut across one another and are really interrelated, our work is pretty much at the centre of all of our work is a vision to reduce inequalities in diets. And so even with respect to the supermarket work we do, there's a equity focus throughout all of it. And so we do different types of research. We are mixed methods researchers, and today I'll give a really high level overview of some of the projects we've done in this space. And the research that's included grocery store pricing audits, our move towards using big data to answer some of these questions, qualitative interviews with key stakeholders, so including retailers, but also people with lived experience of social disadvantage to understand the impacts of supermarkets and price on their health and well-being, but also policy work, because we recognise that we do need some high level support to shift some of these things going forward. And I guess just to recognise that all of our work is grounded in a social determinants of health perspective. As Deepa mentioned, I'm sure you're all familiar with this as well, but when it comes to reducing inequalities in diet-related health, it's not really going to be useful to just focus on the food environment. It is really important, as you can see on the left side of this screen, because that's where people interact with the food system. But also on the right side, the left side of this screen, you've got a whole bunch of governance structures and institutional policies, commercial factors, social policies that really drive inequalities in society and practices that exclude certain people from having a voice. And so we like to make sure that we're always considering these factors as well in our work. And so why did we decide to focus on food price and diet affordability a few years ago? Well, we started pretty broad when trying to understand where we should start to reduce inequalities in population diets. And so we did a review looking at the factors that people perceive to influence their ability to access healthy diets. And in particular, we looked at how these factors might differ for low socioeconomic groups. And what you find and what you cannot ignore is that food price and diet affordability comes out every time as one of the biggest factors that drive food choice. And that's why it's in bold, and that's why it's big in size, because it matters to everyone, but it's especially important to our lower socioeconomic groups. And so this is thinking about how it does impact lower socioeconomic groups. We conducted a study a few years ago now, at the beginning of the pandemic, to look at how low-income households were experiencing food in the context of the social policy changes that occurred. So when job seeker was essentially doubled and there were additional income supports provided to people, we wanted to see how this was affecting people's access to food. And what we found was that cost still mattered. You know, people still are very price sensitive, even with the doubling of income. And so what this single mother of two from regional Victoria told us was that, you know, a bag of chips is $1.75 in the supermarket, carrots, hummus and celery are $6 or $7. I know what I'm going to be picking if I'm in a pinch, and it's not the healthy choice. And so I think it's important to always have these stories at the back of your mind when you are trying to think of how we're going to shift the food system, because that is the lived experience and reality of millions of Australians. And our methods need to continue to reflect that. Yeah, so again, we can't, and I think it's also important to note that there's a lot of stigma around food poverty and food insecurity in Australia, and poverty more generally. But yeah, we can't be judging people until we've really understood their stories. And so thinking about now costing healthy and unhealthy diets and how we go about it, it's a fascinating question, and I honestly didn't think I would spend 5 years trying to understand it. I think when you think of food price, you think it's pretty simple. You collect a price and match it to a food item, and that's the end of the story. That is not the end of the story, that is the beginning of the story. And so I guess the first thing to say is that the ASAP methods have been developed as the optimal approach for monitoring food price and affordability in Australia. I'm sure a lot of you are familiar with them. They are the Australian Standardised Affordability and Pricing Methods. What they involve are going into stores and local government areas and collecting the price of foods from two diet baskets, a healthy and an unhealthy one. And there are about 44 food items in the healthy one and 60 in the unhealthy one, which also includes things like alcohol and a lot of discretionary foods. And so I guess the first step we took was to see if we could take these methods online and streamline them to do them more efficiently, with a view to work towards upscaling them. And what we did find was that you can do this. Supermarkets are very good at putting in the same information online and in store these days. So it's definitely something we should continue to be doing. And what is pretty consistent in the literature now from a lot of the studies is that a healthy diet costs a family of four about $600 a fortnight, and that the unhealthy diet is about $100 to $200 more expensive. And so we can talk about methods later, but that is what the evidence says in Australia to date. And then we went on to use these methods to upscale them, conduct a national pricing audit around Australia. What you find and mind you, we do collect we collect the data from the major supermarkets. So you find that there are pretty consistent prices around Australia. When it comes to look at variation around the country, it's actually income that drives differences in affordability more so than price. And this is particularly reflected when you look at low-income families. And it's also pretty consistent in the evidence now that healthy diets are unaffordable for our low-income families. It costs them about 25 to 30% of their income, and that is a rate that is classified as food stress. And so if you think of the millions of Australians that are classified as low income, there's a lot of people that are struggling to access healthy diets. And I think there's a statistic that says somewhere that about 1 in 6 Australians really don't like grocery shopping because it's a huge stress for them. And just lastly, a limitation of these methods is that we don't collect data from remote and rural communities where there are obviously bigger disparities and issues because there aren't major supermarkets present. So this is something that we need to continue to think about and address going forward. So thinking about price monitoring now, the challenges, the opportunities, I think big data, while I'm not a tech nerd and I don't think big data will solve every problem, I think when it comes to price monitoring, there is so much we can be doing right now to use big data and AI to really make these methods more efficient, but also more relevant to everyone on this COP and local governments and politicians so that they can see the numbers and see what they mean for them and their practice. And so, yeah, we are doing some work at the moment to test some new methods in this space. And they do involve using some bigger data sets and linking the data sets together. And so I guess thinking about the potential that exists when you do use big data, we use the big data sets to look at specials in Australia longitudinally over a year for the first time a few years ago now. This was a huge program of work we did on supermarket specials. And essentially we found that supermarket specials are put on unhealthy foods and drinks twice as often as they are on the healthy stuff. So they really do sway consumer purchasing, and the depth of the discount is also almost twice as big for the unhealthy stuff compared to the healthy stuff. And so using some data from New Zealand, we found that about 1 in 2 of what people purchased was on special. I was pretty shocked by that statistic. I didn't think it'd be that high. But it just goes to show that specials are really, really prevalent in the supermarket environment and important for people, and in particular people on low incomes. I had one participant tell me one time that it was a way that supermarkets manipulated low income consumers. And so that really changed my perspective to specials. And again, what you see is that they're purchased across most food and drink products, but you know, sugar sweetened beverages, confectionery, snack foods, it's almost about 60% of what people purchase is on special. And again, I think the story behind it is pretty much drives the messages home. I had a participant tell me one time that, you know, Doritos are always on half price. I'll just buy a bag and that could be lunch because I can't afford anything healthy. And it's the same with catalogs too. The front and the back is all the unhealthy stuff and not the stuff that you should be buying, but it's the stuff that's always going to be on half price. And so now thinking about action, how do we actually have an impact in this space? Because yeah, there's a lot going on in the price space. So what do we do? So we've done a few studies working with retailers, in particular rec centres, but also evaluating the Eat Well at IGA intervention to look at perceptions of retailers of the factors that are relevant to feasibly and acceptably change food pricing so that it promotes health more. And this figure shows you some of the common themes that come up when you do talk to retailers. I don't think it will be too surprising, but you've got the structural and organizational characteristics that include internal factors. So things like within the retail environment, is there a leader? Is there a champion? Is there someone that wants to see this change? That was really important for the Eat Well at IGA intervention. And then externally, that you've got the role of local governments, researchers, and other people that are going to be providing the resources, the expertise to help the retailers change. It is a partnership approach that you need to change the food system. And then you've got the characteristics of the actual pricing strategies. What the literature will tell us is that obviously we need to keep the healthy stuff as affordable and a low price as possible, and then increase the price of the unhealthy stuff. But that doesn't always fly well with retailers. And in the EWEL at IGA intervention, the pricing strategies were actually put off the table because the retailers weren't interested in doing them. And I guess even in the rec centres, there were some food and drink products that you essentially can't touch because they have such high profit margins and they're so critical to business operations, and they are the junk foods, that it makes it really hard to shift the prices of certain products, but not impossible. And we have seen that with some of my colleagues' work in some of the other smaller retail settings. And lastly, it all comes to business outcomes, right? And I think this is where we have a problem with health promotion meeting the commercial determinants of health. Our goals are to promote health, and retailers' goals will probably always be to increase their profits. So what are we going to do about that? Some of my colleagues work on building the business case in this space. So, you know, how do we do that to talk the same language with them? But at the high level policy level, I guess it's, you know, I'm trying to sugarcoat it, but I don't know if I can. When it comes to addressing food price and the broader social determinants of health to reduce inequalities in population diets, not much is being done. And we've got a few studies have shown this now by analysing policies across countries. And so in Australia, though, I will say that the good news is we have a subsidy on a lot of core foods that keep the price of things like fruits and vegetables down. It makes our healthy diets a lot cheaper than those in, for example, New Zealand. So things like that should never be taken off the policy table. We need those subsidies in place, but we also need to be doing a lot more, including things like taxing sugar sweetened beverages and regulating price motions like they're doing in like they're planning to do in the UK at the moment. And so I guess in the fact that we don't have policies is actually it does have a real world impact again on people and in particular on people who are living in poverty and who are struggling the most. And so this is just a story, you know, this person told me that no one should be disadvantaged by the food that they have to eat. They have to choose between their food or their house by paying their rent because obviously housing takes up a big part of their income and budget. Then they have to choose between the internet for their children because they have to obviously do schooling, especially during lockdown when that was all shifted to home. And you know, parents want to be able to do it all. They have the best intentions for their families. And really, we don't live in a third world country, but sometimes for many Australians, it feels like it is. And so I thought this really summed it up well. You know, this is what it's like living below the poverty line. You'll probably remember the job seeker support was raised by $50 last year. It's the first time it's been raised since 1994. And obviously it has not kept up with the increase in cost of living. And so, you know, when you're living below the poverty line, an extra $3.57 doesn't go far. But obviously when you live below the empathy line and maybe you're a politician, you think maybe that extra money means a lot to someone. And so now just to summarize what we've spoken about, obviously price matters for population nutrition and equity. It's the reason I probably still work in this space. I never thought like I would still be working in price, but it matters so much that I think we have to be working in this space. I think that we have so many opportunities at the moment to streamline the way we monitor food and drink prices, but we also need to be mindful of the emergent policy targets like specials and what we can be doing in that space. But at the same time, you know, we need to break down the silos. We need to address the social determinants of diets and recognise that equity is not a priority when it comes to policy action, at least at the higher levels in this country. But in terms of looking forward to the future now and some exciting possibilities, I think, in this space is that there are there's a lot of media interest and political interest in food price at the moment. Just this morning, my mum sent me a photo. There was another segment on the news about, you know, how expensive diets are at the moment and how expensive the healthy stuff is. So it is getting a lot of attention, and we have had some high-level political interest in this space. And that includes the recent Victorian government task force on food insecurity, the development of the Victorian Food Stress Index, which was actually led by VCOS. So really cool to see that intersectional work happening and us trying to break down those silos. And so, you know, whilst the pandemic wasn't really great, it's really thrown food insecurity and food price into the public spotlight. And it's something that will actually never go away. So it's something we always need to constantly be thinking about as a problem, and as something we need to address. I think I've spoken to the potential to be using big data and potentially AI one day in this space. But also the importance of really contextualizing our numbers in people's stories. Numbers only mean so much, and probably to a select few people. And I think the thing that I'm now starting to think about in my work with Vic Health, and, you know, drawing upon their expertise as well, is that you know, there are issues with intersectionality in this work. It's single mothers that are really being impacted. It's people with disabilities and other mental health issues. So how do we change price and change the social determinants of diets to best support those groups? And I think that's it. But just lastly, to say thank you. Obviously, this work can only be done by, you know, a huge team. So thanks to the team and the funding and everyone who's contributed to the space to date. And thank you to all of you for listening. I'll leave it there.
Thanks so much, Christina. Lots of food for thought there, if I'm allowed to use that pun. Yeah, really fascinating data and knowledge that's been collected over the years. I know my brain's ticking. I'm sure everyone else's is as well. But yeah, thank you so much for presenting your team's learnings over the past few years. If you do have any questions for Christina, please pop them in the chat and she will be answering them. Otherwise, there will be an opportunity later on in the Q&A session to come off mute and ask Christina more about this fascinating topic, and thinking about some reflections as well and takeaways to our own workplaces. So I think we've been going for almost an hour, but we're going to have a 5-minute stretch and drink break now, just so you can move and get out of your chair and have a drink. And we'll bring you back in 5 minutes from now. So it's 10:53. And Deepa will bring us back for the community health update section. So look forward to seeing you in 5 minutes, and go have a drink and a stretch. Thanks, guys.
Hi everyone. We'll just start coming back slowly. I hope you had a good break. Okay. Great, we'll get started again. Firstly, thank you to Christina for an incredible presentation. Feeling angry and wanting to change everything now about pricing, and really good comments from Lisa as well about the price of food and the impact that it's had for farmers and the recent kind of wage changes. So it's thinking about that really big food system problems, aren't they? It's just not individual components that we're trying to solve. We've got a very big problem and very big system to address if we want to do things equitably and sustainably as well. So as mentioned at the start, we have our community health updates and we have some great speakers today. I'm really excited to introduce to you. So first we have Freddie Durudikatu from Ballarat Community Health on the Eat Well, Feel Good Ballarat project update. So Freddie has worked in the health promotion and healthy eating space for over a year now. He enjoys using his skills to contribute to public health. Freddie has worked as a project officer in the Eat Well, Feel Good Ballarat Healthy Supermarket pilot program with Ryan's IGA Ballarat Supermarket and is currently working on developing and implementing a part 2 for the same project. So welcome, Freddie, and we look forward to hearing your presentation.
Thanks, Deepa, for the introduction. I believe you can see my screen that's been shared. Yep, perfect. Hi, everyone. Good morning to all present here. As Deepa said, I work for the Ballarat Community Health in this healthy eating space. I would like to kick off by acknowledging the traditional owners of the land in which I live in, the Wadawurrung and the Dajatajawurrung people of the Kulin Nation, and pay my respects to the elders, both past, present, and emerging. Just a quick update about our phase 1 of the project. The Eat Well Feel Good Ballarat is a 9-week. It was a 9-week pilot project. It was carried out by Ballarat Community Health in partnership with Ryan's IGA. The Healthy Supermarket project was inspired and adapted by the Eat Well at IGA, the Bendigo project. The main goal of our project was to test and trial interventions to engage supermarkets to promote healthier food and drink choices using the Health Star rating system and a health promotion campaign designed to increase the ease for customers to identify and select healthier options. This project also intended to increase partner and stakeholder understanding of how health promoters can work with supermarkets to create local environments that support access to healthier food and drink options. The project was conducted at 3 Ryan's IGA stores in Ballarat. It went on from the end of April 2021 to mid-July 2021. The in-store promotion materials were designed to promote fresh and frozen fruits and vegetables, which was considered all 5-star options, and other packaged food and drink products with a health star rating of 4.5 or above. The promotional materials included shelf wobblers or labels, as you call it, flow stickers, fridge stickers, basket inserts, banners, staff badges, a staff educational flyer, recipe cards, and social media posts. The media coverage for the project was done through news channels, newspapers, and social media posts of other organizations and partners. We also developed a website for the same. So now coming to the evaluation part. So in the last community of practice, I had given a brief update of the project, but we didn't get into the evaluation aspect. So now we are done with that. So what we did was we had customer surveys, staff surveys, store scout analysis. We got the store sales. We did manager interviews and also did an in-store monitoring, which is done through our volunteers. Few highlights from our customer survey results. We managed to survey 259 customers who visited at least one of the 3 IGA stores during this time frame. 83% of the customers surveyed had knowledge on the Health Star rating, however, only 62% used them while shopping. We found out that 55% of the customers noticed at least one of the campaign materials while doing their supermarket shopping. The most noticed campaign materials was the shelf wobblers, as it was the most highlighted point of sale material. And out of those who noticed this, 48% stated that this had somehow influenced them in what they purchased during their shopping. Some of the other points that I would like to highlight are the customers mentioned that the messagings were easy to understand. It's made its point in a very simple way, and was kept simple. A key statistics again here was 93% of those customers that we surveyed mentioned that they believe that IGA should continue doing projects like these. Staff survey results, we managed to survey 52 staffs across the 3 stores. 88% of them had favorable perceptions about the project. 21% of the staff reported that campaign materials had interfered in their work in some way or the other, mostly shelf wobblers. 13% of the staff were involved with the project in one form or the other, be it maintenance or installation of the campaign materials. 69% read their staff educational flyers. And all of them believe that IGA should continue promoting healthy eating activities. Another point I would like to highlight here is when asked what can be improved, they said that if we have better staff educational resources for them to understand the Health Star rating and also the campaign materials, that would be better. We interviewed 6 managers, 2 from each store and the store owner. The interview was analyzed thematically, and as you can see on the screen, we came out with all these: the supermarket and public health context, the enablers and barriers, campaign material effectiveness, customer and staff feedback, and future intervention plannings. 2 key points I would like to say here is one, it was highlighted that a strong partnership formation and maintenance between BCH and Ryan's IGA was key in in the success of the project. And the second one is the credibility that was achieved in the project because it was rolled out by a health agency. The Store Scout analysis. So a Store Scout is an app that was developed by Monash University to determine the store healthiness by marking it against the 4 P's of marketing: product availability, placement, price, and promotion. So we conducted the Store Scout analysis prior and during the intervention phase at all the 3 stores. And we saw an average increase of 7% in the store healthiness. Most of this was in the promotional aspect because that's what we targeted during our phase 1. Once this was completed, it gave us a list of recommendations on how a store could increase their the healthiness scores. I would also like to highlight we had store sales analysis done. Even though we saw like an increase in sales of 4.5 and 5-star rated products that we promoted, there was general increase in the sales. So it was kind of inconclusive evidence for us. The second was the in-store maintenance. So volunteers went out and had a look around, just keeping a note and track of all the campaign materials. Some points where we found out that there were certain materials like the shelf wobblers, it was less sustainable, and it was marked on that. Once all these evaluations were done, we had our resources developed. That is, we completed the evaluation report and we also made an implementation guide. So this all happened after the community of practice in October. So I would say it's like it's not a guide, but it's like a learning from our project. So if anyone would like to get in touch with me, I've also shared this with Vic Health. So please feel free to touch base and I can share the resources. So once the project was concluded, we still stayed in touch with the managers and also the supermarket owners. by sharing the resources that we developed, be it recommendations, evaluation reports, and the learnings. We also shared the recordings of the community of practice that happened back in October. We also discussed about a possibility of a phase 2 for the project. And having a look through the recommendations and the evaluation report, the supermarket owners gave us a positive reply on that. We also consulted with our partners and stakeholders, and once that was done, we thought an initial planning and consultation phase for the phase 2 with the supermarket owners was the first step to get started. So during the planning phase, it started off in February this year, we discussed about our new capacities, the roles and responsibilities, resources, and went through the list of recommendations from phase 1. So from our learnings, through research and through consultation with experts in the field, I think many of them are part of the community of practice. Mel Deutscher from Central Highlands PCP, Kate Falconer, BHS, Dr. Adrian Cameron, and Dr. Amy Brown, who worked with Eat Well at IGA. We were convinced that we need to focus more on sustainability of the interventions and also like expand our scope through new interventions. So with sustainability of interventions, we thought of replacing the shelf wobblers with something more sustainable like a shelf banner or a flag. And we are still discussing the possibility of how we can roll it out with the supermarket managers. In terms of new interventions, we want to tackle, we have created a staff educational video for the IGA staff members. We entered into the in-store radio promotions, front of the store digital promotion, planning on having a trolley signs put up. We also want to enter into the bakery space by promoting multi-grain and whole grain products, and also want to tackle the second P of marketing, that is placement, by doing work with the end of the aisle displays and also with island bins. So to assist us to develop the implementation plan and also to develop a new campaign materials, we had 4 Monash University dietetics students join us for a period of 7 weeks. So that they were really helpful in helping us design and make new materials. One of the areas that we wanted to tackle was the healthy checkout space. But during our planning session, and once the conversation went back and forth, we got to know there were contract issues. And because of that, we couldn't work in this space. Our project utilized the Health Star ratings, and it kind of revolved around this for the entire duration of the project, be it in terms of messagings, in terms of point of sale promotions, where we had to identify the products because we promoted 4.5 and 5-star rated products, to promote this Health Star rating via our Food Switch app or by using them in our promotional materials to increase the awareness and usage for shoppers during their supermarket shopping. I would like to say, please feel free to touch base with me regards to any resources, campaign materials that's been developed, or anyone from the Ballarat Community Health Promotion team. Yeah, thank you all for tuning in.
Great. Thank you so much, Freddie. And that was such a great presentation, and so great to see that there was such interest in the community and the staff as well to continue these kind of projects. And the reports have now been shared in the chat as well for anyone who's interested, the reports that Freddie mentioned. So now we have Irene Dunn-Pfeiffer and Benjamin Bruin from Eastern Health to speak about building local stakeholder relationships. Irene is an experienced health promotion practitioner with a Master of Health Promotion degree. She has worked on a broad range of projects and health priorities in communities across metropolitan Melbourne the last 5 years at Eastern Health. Benjamin is the Senior Health Promotion Officer at Eastern Health and has been part of the team for 5 years. He has supported, led health and wellbeing initiatives and partnerships focused on a range of health priorities and settings. So welcome, Irene and Benjamin. I'll pass over to you both.
Okay, I think
Thank
Benjamin.
you. Yep, thank you. Sorry, I was just getting myself sorted. Everyone can see my screen. Thumbs up. Yep, perfect. Well, thank you. First of all, that's a hard act to follow, Freddie. That was a fantastic slideshow presentation. It was great to hear about your work. I'll take a moment now to acknowledge the traditional owners of the land of which myself and Irene are meeting. So we're both on Wurundjeri land, and I'd like to pay my respects to the elders past, present, and those emerging. So today we're just we're going to talk a little bit about our experience with engaging supermarkets in the Yarra Valley. I'm going to just touch on very briefly some work we've done historically with a few supermarkets in the Yarra Valley, and then Irene's going to dive a bit more deeper into a current piece of work that us and Yarra Ranges local government and also a few other partners are working on as well. So just a real quick background of our catchment of the Yarra Valley. I hope all of you have been there or know it quite well. It's such a beautiful area. We have all the kind of usual players in terms of supermarkets, Coles, Woolworths. We have quite a significant amount of independent grocers and smaller IGAs and a few really quite large built up IGAs, specifically in Yarra Glen. And we've recently been lucky enough to have a few Aldi's open up. We've got one in Seville, and we've also just recently this year had one open in Hillsville, and really important for us because historically we've had significant issues around access to healthy food, and the emergency relief sector in Yarra Valley is quite prominent and really essential for a significant section of our community members. And I'm just going to talk a little bit really briefly about some of our past experience working with supermarkets as partners and some of the things that we've done with them, and that kind of led to us wanting to work with them in a more formal and a long-term partnership. So really our health promotion team has had a bit of an ad hoc approach to engaging with and partnering with supermarkets on specific projects within the Yarra Valley. We've had kind of 3 instances where we've had really kind of positive outcomes and worked in partnership. And 2 of those scenarios were with Coles. So one of a previous staff member at Eastern Health had a relationship with a store manager at Coles in the Yarra Valley catchment, and they both had an appreciation and understanding of our work, and we actually formally asked Coles to support and fundraise for a large forum event called the Be the Change event, which was focused around women in sport. And not only did they agree to support, they actually provided the fundraising for the venue hire and the catering, which was really unexpected and really appreciated. So that was a really kind of eye-opening experience for us, because at that stage we hadn't really done any work with any supermarkets. So for that to happen for us to ask that question, and for them to be so positive and come back and say, yes, we're more than happy to support and work with you on this event, was probably the first little door opening for us to go, okay, so maybe there's more to this. We can actually engage with supermarkets as a possible partner in the Yarra Valley. And then around 12 months later, we had another similar project, and it was a larger kind of event around women in leadership. So following on from the Be the Change event, and we went back to that store manager and asked if she was willing to, be a part of it. And to our, surprise and to our excitement, she was more than happy to come along and provide her advice and her experience as a panel member around being a Coles store manager and talk about her ambitions and her experiences. And that was really powerful because we had quite a diverse panel. I believe we had a local member of government, and we also had an AFLW player, and it was fantastic to have a local store manager from Coles come and give her experience of becoming a store manager and her ambition. So that was really good. And then the third kind of piece of work historically that we've had some engagement with supermarkets has been the healthy food basket surveys, and some conversations around emergency relief. So a lot of these have just been more with individual stores, and when we've gone in to conduct the surveys and speaking to store managers and hearing about their passion and their desire to do more community-based work and to potentially work with us more in the future. And so I guess the learnings we took out of just some of this past experience is that, yes, we can engage with them and that we should be, trying to work with them for some of our health promotion efforts. And now I'll hand over to Irene to talk about the new focus for our team, the Our Food Connections work. Thanks, Irene.
Thanks, Benjamin. Yes, so this gives a little bit of context and background to our current engagement with supermarkets. And they're part of a much bigger piece of work we're trying to do in Yarra Ranges to create a better food system, which is a big ask, but we have a lot of partners working on this. So a partnership was developed between Yarra Ranges Council, Eastern Health, Inspiro Community Health Service, and the Outer Eastern Primary Care Partnership to develop a project and have leadership, a leadership group to develop to focus on the food system and creating a more sustainable, healthy, and equitable food system. This work led on from seeing the work that had been done in Cardinia or the Moreton Peninsula on these community efforts around improving the food system. And Yarra Ranges needed that work. It's a very rural community. It has lots of little townships. It has lots of food insecurity, as Benjamin has said. And it's a system where there's really, really great work taking place, but it happens in isolation and people aren't connected. So this group came together to provide direction and a group to lead this work and involve and engage community and empower them to improve the food system. So I've just put in the chat the link to the Food Connections group. So it's a website. The website was set up to connect people and also provide access to resources, celebrate work that was currently being done in the food system that was positive, and connect people with resources like neighborhood houses, for instance, with excess food that they could use in their cooking classes, down to that level of detail, to celebrating work being done in schools, with school gardens. So it's like this collective website that's going to hopefully be the interface for work being conducted in the food system and directing key actions that will be done in the next 4 years or so. So identifying 4 key priorities that we'll work on and the actions within those priorities as well. So a big part of this work was conducting interviews with stakeholders in the food system in Yarra Ranges. And there were 2 pieces of work completed. So there was interviews conducted with stakeholders in the food system, and there was interviews conducted with community members and their views on the food system in Yarra Ranges. This was to gather information about their views on what they thought of the current food system, what their contribution was to the food system, what their role was, them acknowledging that or realizing what that was, and then asking them what were their priorities for a healthier, more equitable, sustainable food system. So supermarkets were part of this engagement. So we interviewed farmers, we interviewed people selling food, fresh food at markets. We interviewed neighborhood houses. We interviewed community garden presidents. We interviewed community groups focused on food, such as Permaculture Yarra Valley, to get their views. And so we had a wide range of views on what needed to happen. And out of that consultation came a view that supermarkets needed to be doing more, that they were a big part of the food system and a big part of the problem. And so they were a piece of work that we needed to take action on and do something about whatever we could as a community collective. So we tried to engage with supermarkets in a variety of ways. So we dropped in on some smaller ones, like smaller IGAs and community grocers, and tried to talk about the work we were doing and what we were trying to achieve, and would they be willing to be interviewed for their take on the food system. With the larger ones, we had formal letters, like for Coles and for Woolworths, explaining who we were, what we were trying to do, and we just wanted to have a conversation about their role in the food system. It was very difficult. The time we were doing this work was unfortunate because it happened right around the time all the supply and staffing issues happened in supermarkets during a COVID restriction time and COVID outbreak, when we had a peak. So they were very sort of focused on, pressing issues, and not sort of as willing as they might otherwise be to hear about what we were doing. If I could go to the next slide, Benjamin. What we gathered, though, the local insights from this was that the food system interviews that we did overwhelmingly showed that the community wanted increased support for community food programs, for them to support that, for them to provide excess food to community, for them to donate food to community programs, for them to have more local food on sale. So these were the sorts of things the community wanted to see. What we discovered, though, was certain initiatives in the supermarket are controlled by the local manager. For instance, the local manager can, as in the case of Coles Healesville, can donate to projects, can provide food for emergency relief to a community-run cafe. But that's sort of all that they can control. In terms of anything to do with their, as Freddie knows, obviously, from his presentation, in order to do much at all, it takes a lot of commitment from management, and it takes a lot of control from them and things that they're able to control. So in other words, if you can't get past the local manager, you really can't make any meaningful change in what they're selling or what their products are. But we see it as still a way to build a relationship. So say we're only talking to the store manager, and we get the store manager to work more with community and provide more resources. We don't see that as a sort of not making progress. We see that, as we've learned in all our health promotion work, it's about building relationships. And if we can build that relationship, and if we can have more of a community movement and demand for local products in local stores of fresh fruit and vegetables, then that's a success as far as we see it. A lot of the regional, we discovered too that regional managers control multiple stores. So if you can get a hold of and influence that regional manager, you can have an impact on several stores. We also had sort of like a pushback, and this came from one of the major supermarkets. Sort of like, we hear what you're saying and it's great what you're doing, but we're doing work too, and this is what we're doing. And it's sort of saying like, yes, we know that this is important, but we're doing that already. Look what we're doing. And it's kind of that sort of message that Coles have around their Together for Zero, and the ads have been on television recently. It's also what Woolworths are doing with their greening, thinking for a better tomorrow. And they've promised on this initiative, they've said that they want to materially increase healthier choices in our customers' baskets. Well, that would be a conversation piece for us in engaging with supermarkets ongoing, is to say, you're saying you want to materially increase healthier choices in our customers' baskets. Well, what does that look like? How do you plan to do that? You know, how can we connect you with our community efforts? Because that's what we're trying to do too. So it kind of provides I don't know, like a way to engage now that we know this about them, that we're saying, you're saying all of this, and the community, making this known in the community so the community know that they're saying this, and sort of empowering that community to demand something around that that's meaningful to them, that's tangible, and it's not just a statement. So next slide, Benjamin. So our plans are to re-engage with the supermarkets and promote our food connections. The first time we went out with the stakeholder interviews, we didn't have a website. We didn't have priorities. We didn't have the community engagement we now have. So we'd like to revisit and explain where we're at with this project, how much community engagement we have, and determine what priorities, sort of present the priorities that we have and the key actions, and ask them to identify where they can play a part in what we're trying to do. And we feel like these might be small steps to changing the food system, but they're definitely steps toward changing the food system. And that's it from us. Thanks for listening. If you want to know more, the next slide has our contact details. But do have a look at the what I've put in the chat, the Our Food Connections, to get a sense of what this initiative is trying to do in Yarra Ranges.
And happy to answer any questions about our experience with engaging in supermarkets. So thank you. Thanks everyone. Thanks Irene. I'll stop sharing my screen.
Thanks, Irene and Benjamin. Fantastic presentation and fantastic local insights that you've shared with us. Really appreciate those local insights of what you guys found useful, and also taking that systems approach, which is really important. So thank you. If anyone has any questions, after we jump into these breakout sessions, we will do a Q&A where these guys will be back and you can ask them a question live as well. So next we have our breakout rooms. So this is a chance, as Deepa mentioned at the start, for us to really get to know each other a little bit more, have a break from listening and do some talking. So soon Julian's going to break us all out into 4 separate groups where you'll have a Vic Health facilitator to facilitate these small sessions for around 10 minutes. So just a chance to introduce yourself, your name, your role, your workplace or your business that you come from today, and perhaps some insights and some takeaways in the presentations that you've listened to so far, and perhaps what you can bring back to your own workplace or local community. And then we'll get a delegate just to report back to the wider group at the end. So how are we going with setting up the breakout rooms, Julian?
Almost there.
Excellent. So this is always my favorite part of Zoom sessions, just to meet others in the room and put faces to names. And yeah, often is a great opportunity to network and then take people's details away later and continue the conversation. So I really encourage you to share a little bit about yourself and any reflections that you've had so far in the session today. See you soon. All right.
Okay, great presentation, Freddie. So just to start off, I just thought we'd do some quick introductions, so just your name, your role, and your organization or workplace that you're coming from. So I'm Nicola, and I'm the student for the Healthy and Sustainable Food Systems team here at Vic Health. Nice to meet you all. So I'll pass it on to Melissa. Did you want to pass it on to? I'll throw it over for you. Siobhan? And Mel? Yep. Louisa? I think it sounds ready. Did you want to do another quick or? Cool, thank you for that. Just to start off, like, what were some key insights or takeaways that you got from this presentation? Does anyone want to kick off? you for sharing that. Were there any other insights from anyone from those presentations today? Thank you for that. Yeah, for sure. Yeah, definitely. No, sorry, I saw you unmuted. Was there anyone else? Is there anyone else that wanted to share any insights from this presentation? So yeah, those presentations are just really great. It's my first time attending a community of practice, so it's really interesting to hear what's been happening and the updates and also the stats that was shown. Definitely, yeah, everyone's presentation stood out. Like what Melissa was saying, there's two more than Mel was saying. Yeah, I totally agree. Like price is an issue that's also happening in schools and canteens as well. It's like that affordability aspect. So breakout rooms seem to be closing. Was there anyone that wanted to be a delegate from this group that wanted to share really quickly? if I nominate I'm going to nominate, sorry. So I'm going to choose Mel. That's okay with you? Awesome. Cool. So I'll see you guys in the breakout room. And yeah, thank you.
Hi everyone, we'll just wait until in the room. Great to meet some of you face to face. It's always nice to have a chat and share insights and work that you've been doing in your own local community. So we'll just wait until everyone's back. Okay. So, because we're running a little bit behind with time, I would encourage all the group members, or if you've chosen a delegate, just to pop something in the chat in terms of what your group discussed and the main insights and takeaways from today. So we'll go straight into the Q&A session now. So this is an opportunity for you guys to either ask a question in the chat or raise your hand and come off mute to ask any of our presenters a question today, or us, or anyone. So this is your opportunity to delve go a bit further. So is there anyone that has a question? Might need help because I can't see the questions at all in the box, but raise your hand if you've got a question, or feel free to pop it in the chat and we can read it out for you as well.
Lisa has a hand up. Lisa, over to you.
My first session today was amazing and awesome, so thank you. I better put my mic near my mouth, that'll help. Taking Mohammed to the mountain versus the mountain to Mohammed. How many people in the guest speakers today are going to like the annual fresh produce conference called Hort Connections, which is where thousands and thousands and thousands of farmers go, and is run by Coles and Woolies and everything, and is pretty much the price setting conference per annum for the Australian food system. And so sort of immersing yourself in that space to actually understand the inner machinations, so that when we do get to our local supermarket managers, we kind of know what's coming from the top down per se, so that we can shake the tree from the community side up. So I was just wondering, you know, what sort of immersion in the actual industry have you done to also inform the projects that you're doing?
I can go first and say not much. I think it's actually one of the big issues. Issues might not even be the right word, but like in public health, we're often a bit standoffish about like engaging with those sectors, which means we don't obviously understand how they operate, how these things work. And yeah, I don't know, it's a tricky space to work in, and I'm not going to that conference. Maybe I should be, but yeah, I really do struggle with that divide between like we promote health, we do everything else, and so keen to hear what others think about how you work with that divide.
It's a good comment, Christina. I was just going to mirror Maddie's comments. That sounds really interesting. And if you could put that in the chat, thanks, Lisa. I think we would probably err on the side of attending if we're allowed to. If that's something that is you know, if community health would be considered attending, whether that's us or another member of the Our Food Connections work. If we think that will help create some, or potentially establish some new partnerships or help our work in any way, shape, or form, we wouldn't be against it. So yeah, thanks, Lisa. That's a great insight.
It's a bit of a Dorothy Dixer question because I do know some of the answers for you, but what I was going to suggest as a solution, if you hadn't, find out which local connections in Victoria are attending so you can catch up with a post-conference chat, because it's literally the Disneyland of fresh produce for Australia per annum, and major things happen in the food system literally at this conference, which will then roll out. And this year it's the first face-to-face in 3 years since COVID. So there's going to be a lot of change, including what I put in the chat today about the new horticultural wage scenario, which is record-breaking in Australia since we've had settlement industrial agriculture. So it's actually quite a big change. But it's once you walk in and make those connections, you start to understand some of the nuances that Christina, your comments in your presentation, and Benjamin and Irene and Freddie loved it, just, gelled together. So thank you.
Thanks for your question, Lisa. Anyone else have a question for our panel today? I can't see anything else in the chat. I think Lisa's popped the link in the chat, which is great.
I'd be happy to. Oh, can you hear me? Sorry.
Yes.
Yeah, sorry. I had to jump off my computer because I ran out of battery, but good. I'm glad you can hear me. This is Melissa Deutscher from Central Highlands PCP. I just had a question for Christina. Thank you so much for your presentation. I was saying in my room that I was a little bit down after that. Just feeling that a lot of things are out of our control, especially at a local level in the supermarket projects that we're maybe undertaking, but also recognise that it's a really, really big, important factor. And so I guess my question for you, Christina, was, given that, when we are working with retailers, one of the things they don't really want to work on is price. What would be something that you would suggest that we could do at the local level in terms of tackling the issue with price? I think it's really relevant, especially today, as we hear about, inflation and, these increasing prices in our supermarkets.
Yeah, I know. I don't mean to get people down about the topic, but at the same time, I don't think we should dance around it either. We often take a critical approach to our research, which means our job is to reduce inequities and highlight structural inequalities in society. So yeah, I don't know. I didn't mean to make people feel down about it, but I do think with the work that we're doing now through my fellowship with Vic Health, the whole goal is to start advocating for change in this space. So our hope is to develop an advocacy coalition that's very active, very embedded in community voice, and takes these issues to a whole new level. So, just connect with people who have the stories to tell. Find opportunities for those stories to be heard by your local decision makers or higher up if you can. And just make sure that these issues aren't being swept under the rug. I think that's what I try to do through my research. Hopefully in our lifetime we see change, but we may not. It doesn't mean that we shouldn't stop pushing for change. So yeah, I just say, don't be afraid to speak up about the issues and take them to the people who can affect change. Hopefully that gives you a bit more hope.
Sorry, I didn't mean to say you're all doom and gloom. It was a great presentation and I've got a lot out of it. But yeah, thank you. I really appreciate that. And I think that's a really good point about connecting the people that have the stories with those that have the influence. That's great.
Yeah, and it's all in the media now as well. So, if you've got a local newspaper or someone who's really in the local media, ask them if they'll run a story and start advocating for change. It's everywhere. It's an issue that local government are aware about too. So yeah, find the champions and make change happen.
Thanks, guys. We're running a little bit behind, so we might just wrap up the questions there and think about extending it for next time session. But massive thank you to all our presenters today, Christina, Freddie, Irene, and Benjamin. Really appreciate the work that you're doing and for sharing it with all of us today. So thank you so much. Next, we have a new segment of community announcements, where it's an opportunity for you guys to make a quick announcement about a course or anything relevant to helping create healthier supermarkets. So I'm pleased to pass over to Sean Norton, who is a research fellow and is going to speak on behalf of Refresh today. So thanks, Sean. And next slide, thanks.
Thanks for your time. I'll try not to take too long, but I just wanted to discuss a course that the Centre of Research Excellence in Food Retail Environments for Health has developed in collaboration with Monash University. So we ran this course for the first time last year and we're running it again this year. So the course is led by Associate Professor Julie Brimblecombe, with a teaching team from Monash Deakin, University of Queensland, Menzies School of Health Research and Dalhousie University. So we've developed the course in response to a recognised gap in training for people wanting to influence food retail practice and policy. And it's really working to upskill participants with knowledge and skills in theory of consumer decision making, power of marketing and merchandising, and how, when and where to intervene to facilitate change. So the course is delivered by academics that are leading the research in this area at an international level. And it's also supplemented with case studies and discussions with people who are working on the ground. So enrolments for the course will open soon. So I've just put my email address into the chat box, so please get in touch if you'd like me to let you know when enrolments open, and I'm also happy to answer any questions about the course, so please get in touch.
Thanks so much, Sean. It sounds like a fantastic opportunity, and Victoria's just posted a link to a past participant from last year who got a lot out of it and made some really great change in Tassie, so make sure to check that out. We've got 2 minutes to go, so I'll try and wrap it up as quick as I can. So as mentioned in the needs assessment results, there was majority were in favour of having a way to stay connected in between these community of practice events. And so we're really excited to launch with you a Healthy Supermarkets Community of Practice Miro board, which is publicly available to everyone, so you won't need to log in. The link is there. Julian will share it in the chat and we'll also email it to you afterwards. So it's an opportunity for us to all stay connected and add any relevant links, articles, resources, relevant events, just to stay informed. And yeah, we really encourage you to add to this Miro board, and we will send you a reminder from time to time just to review it and add to it as well. Our next community of practice will be on Thursday, July 28th. So Julian will also send around an invitation link in the next week or so. If you have a project update you would like to present on and share with the community of practice, or you have a community announcement to share in July or October, please email Julian as well. So we'll pop that in the chat and we'll send that around afterwards. Next slide. And lastly, just again, a massive thank you to all our presenters today, and a thank you to all of you here today for everyone's contribution and their interest in creating healthier supermarket environments for your own local communities. You're all doing a great job. A reminder that a copy of the slides and recording will be emailed to you afterwards, and it will also be publicly available on the Nourish Network website. So if you know anyone else that would benefit from joining this community of practice, please get in touch via the Nourish Network website or emailing Julian, and we can pop them on the list for next time as well. So thank you, everyone, and we look forward to seeing you in July. Have a great rest of the week, and goodbye. Thanks, everyone.